Good evening, folks. This evening's topic C, title 13 Good Years, a community narrative about midlife brain health. Okay, so here we go with the presentation I made for you. Please enjoy. In every community, there are moments that look small from the outside, but quietly shape the future. They happen in kitchens, break rooms, grocery aisles, church basements, ordinary places. Where people make choices that ripple forward for decades. The story begins on a warm August evening in northwest Pennsylvania, where the sky is turning the color of peach skin and in their circadias are starting their nightly chorus. The conversation on the porch. Maria sits on her front porch, a glass of iced tea uh, sweating beside her. She's 52, a grandmother of two, and the kind of person who remembers everyone's birthday without checking a calendar. Her neighbor, Tom, wanders over, rubbing his shoulder after a long shift at the plant. You hear that talk on the radio today? He asks. Something about how avoiding three things in midlife gives you 13 more years without dementia. Mara raises an elbow. 13 years. That's a lot of living. Tom nods. They said it was blood pressure, diabetes, and smoking. Mara leans back, letting the porch swing, creak beneath her. Funny how things we think are just health stuff turn out to be memory stuff. The science told simply. Later that week, Maria attends a community health night at the library. The speaker, a local nurse named Carla, explains it in plain language. Your brain is fed by tiny blood vessels, she says. They're delicate, they're sensitive, and they're affected by what happens in midlife. She writes three phrases on the board: healthy blood pressure, no diabetes, no smoking. These three things, Carla continues, are the strongest predictors of how long your brain stays clear. People who reach midlife with all three things, with all three in good shape, live about 13 more years without dementia compared to those who don't. The room goes quiet. 13 years suddenly feel like something you can touch. The people listening. There's a retired teacher who wants to keep telling stories to her grandchildren. A truck driver who quit smoking last winter and is proud of it. A woman caring for her husband with early dementia who wishes she'd known this 20 years ago. A young father who never thought midlife started this early. They aren't thinking about disease. They are thinking about the years they want to keep. The turning point. Carla tells them about a man she once cared for, Mr. Jenkins, a mechanic who could rebuild an engine blindfolded in his 50s. He brushed off his rising blood pressure. I feel fine, he'd say. I deal with it later. But inside his brain, the small vessels were slowly stiffening. The damage was quiet, cumulative, and invisible. By his 70s, his memory began to slip. His family watched him fade in ways that felt sudden but were not sudden at all. It was fate, Carla says. It was midlife. The room absorbed the truth. The brain's future is shaped long before symptoms appear. The walk home. After the session, Maria walks home under the streetlights, thinking about her own life. She thinks about her mother, who lost her memory piece by piece. She thinks about her grandchildren, who run into her arms with full thrust. She'll remember their names. She thinks about the 13 years she could keep, 13 years of stories, independence, recognition, laughter. She decides she'll check her blood pressure more regularly. She'll keep walking with her neighbor 3 evenings a week. She'll help her daughter understand the family history of diabetes. She'll encourage Tom to stay smoke free, not because she's afraid, because she wants those years. The community ripple within weeks. The library group grows. People bring friends. Churches host blood pressure screenings. The grocery store posts signs about reading nutrition labels. A local barber keeps a snack of uh, a stack of pamphlets by the register. The message spreads. Midlife is the window. Brain health is community health. 13 years is within reach. The closing reflection. In towns like Meadville, where people look out for one another, this story becomes more than a headline. It becomes a a shared commitment to preserving the years that matter most, the years of memory, identity, and connection. Avoiding three things in midlife isn't just medical advice, it's a promise to your future self. It's a gift to your family. It is a community act of love. 13 more dementia free years, 13 more years of knowing, 13 more years of being fully, unmistakably yourself. Okay, guys, here's the third part of tonight's scene. Okay, on midlife, dementia prevention. Okay, let's see. Here's the headline: the most overlooked window in dementia prevention is midlife. Dementia, often framed as a disease of old age, a condition that arrives suddenly, steals memory, and reshapes families in later chapters of life. But this framing is incomplete. The truth, quietly and profoundly, hopefully, is that dementia prevention begins decades earlier. The most powerful window is not in our 70s or even our 60s. It is midlife, ages 45 to 70, when the brain's future is being shaped silently, biologically, and irreversibly. And 3 midlife factors stand out above all others: healthy blood pressure, no diabetes, not smoking. Avoiding these 3 conditions in midlife is linked to about 13 additional years. Dementia free years. 13 years of independence. 13 years of knowing your family. 13 years of stories, identity, and recognition. This is not a small finding. It is one of the most consequential public health insights of our time, and one we are not yet acting on with urgency. It deserves the quiet biology of midlife. Dementia does not begin when memory falls or fails. It begins when the brain's smallest vessels, thinner than a strand of hair, start to stiffen, narrow, and lose their ability to deliver oxygen. High blood pressure injures them. Diabetes destabilizes the brain's energy supply. Smoking inflames and constricts them. None of these, none of this feels dramatic in midlife. There are no alarms, no sudden symptoms, just slow cumulative injury. By the time cognitive decline becomes visible, the damage is often irreversible. This is why midlife matters. It is the last best chance to protect the brain's vascular infrastructure before decline accelerates it accelerates. It is the chapter of life where prevention is still possible, still powerful, and still capable of changing the trajectory of aging. The human face of prevention. In my clinical work, I have cared for families navigating dementia's long shadow. I have watched adult children rearrange their lives to care for a parent who no longer recognizes them. I have seen caregivers burn out financially, emotionally, and spiritually. I have seen the grief of losing a loved one slowly twice, first to memory loss, then to death. In my health system role, I see the operational impact: rising long term care needs, workforce withdrawal, caregiver strain, and the growing pressure on Medicaid budgets. Dementia is not only a clinical condition, it is a driver of economic instability, workforce disruption, and multi generational stress. When we talk about dementia prevention, we are not talking about abstract risk. factors. We are talking about the future of families, communities, and the economic stability of our state. The policy opportunities hidden in plain sight. Midlife dementia prevention is not high tech. It is not expensive. It does not require new scientific breakthroughs. It requires strengthening the everyday systems that support vascular health, midlife screening and monitoring, blood pressure checks, diabetes prevention programs, and smoking cessation support are not just chronic disease tools, they are brain health tools, ensuring access to give me 1 second, folks. Good to get this. One second. Them is one of the most powerful ways to extend cognitive life. Primary care infrastructure, team based care models, pharmacists, dietitians, community health workers are essential for helping adults manage midlife risk factors. Electronic medical records prompt for midlife brain health counseling can make prevention routine rather than optional. Employer partnerships. Midlife adult. Midlife adults are often in the busiest years of their careers. Workplace screening programs, wellness benefits, and paid time for preventative care can shift the trajectory of brain health for entire communities. Community-based prevention, faith-based organizations, senior centers, libraries, and YMCAs are trusted spaces when they offer blood pressure checks, nutrition classes, or smoke cessation groups. Participation rises, and so does cognitive longevity. Public awareness. Most people do not know that dementia prevention begins in midlife. Public campaigns can change that. When people understand the stakes, they act. Equity matters, folks. Vascular risk factors disproportionately affect communities facing structural inequities, rural residents, low income families, and communities of color. Effective midlife dementia prevention must address transportation barriers, food insecurity, access to primary care, culturally tailored prevention programs. Midlife dementia program prevention is an inequity strategy. It is a chance to close the gaps that have persisted for generations. The economic case. Every year of delayed dementia onset saves tens of thousands of dollars in direct and indirect costs. 13 additional dementia free years is not just a health outcome, it is a fiscal strategy that strengthens families, employers, and state budgets. For Pennsylvania, where long term care costs are rising and caregiver burnout is accelerating, midlife dementia prevention is not only compassionate, it is economically prudent. A call to reframe the conversation. We cannot afford to treat dementia as an inevitable part of aging. We cannot wait until symptoms appear. We must shift the narrative from late life crisis to midlife opportunity. Health, healthy blood pressure, no diabetes, not smoking. These are simple, ordinary, everyday factors, and they add up to 13 more years of cognitive life. The question is not whether dementia will shape our future. It already is. The question is whether we will act early enough to change that future. Okay, folks, that is C for you. And I will try and jump back on, but if not, I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.